and we offer community. So let us build partnerships between faith institutions, government agencies, and civil society. Let us promote prevention through moral education, family support, and community engagement. Let us recognize that addiction prevention is not just a medical issue, it is a human issue. And so it requires a human response. Today, we invite each of you delegates to carefully consider what values are we cultivating in our homes, in our schools, in our societies? What messages are we sending to our youth, not just through our words, but through our actions? Let us invest in prevention, not only through policies and programs, but through people. Let us empower families, uplift communities, and inspire youth. Let this summit be remembered not only for its discussions, but for its decisions. Decisions that protect the vulnerable, that honor the sacred, and that build a future free from addiction. In closing, I offer the words of our beloved Guru, His Holiness Pramukh Swami Maharaj, the creator of the beautiful BAPS Swaminarayan Hindu Mandir in Nairobi. He lived and taught that in the joy of others lies our own. May we find joy in healing others. May we find strength in unity. And may we walk together, Africa and Asia hand in hand, as torchbearers of hope, faith, healing, and humanity. Thank you.
Thank you so much. The chair of the parliamentary, yes, if the video is ready. I think this is 3 minutes, only 3 minutes or. Okay, as they fix that, we have the representative of the Secretary General for the Green Crescent, the International Federation for the Green Crescent, Ergin. Maybe you can come and say a word. They've been very supportive to us, a number of us. We were in Turkey just the other day. I came in on Sunday, Jana. So they've been very instrumental in ensuring that this journey continue, and they're doing a good job. So Ergin, maybe if you can just say a word as they, because he said he was not prepared for this. Yes. Do you have a microphone for him? Just to say hi to the delegates as we.
Thank you. Thank you very much for inviting me for it. Thanks, George. Hi, everyone, distinguished guests and dear friends. It's really nice to be again in Africa and first time in Kenya. I'm representing International Federation of Green Crescents, which has been taking its roots from Turkish Green Crescents, which has been founded in 1920, which is 105 years ago. We work on prevention and recovery on drugs, alcohol, tobacco, gambling, gaming, so chemical and behavior addictions at the same time. We are operating in 65 countries, and I can say that we have the same problems, and we look for the same solutions locally, regionally, and internationally. Actually, addiction is a problem, seems to be a problem of the individual. However, it's a problem and the pain of the family and the community, even the country. And even we see that we try to combine the continents together, like Africa and Asia, that we try to figure out how we can struggle with these addiction issues. I'm coming from Istanbul, which also connects, as you know, two continents, Europe and Asia. And I can say that as we also have the officials in here, addiction prevention and recovery cannot be handled only by the civil society, and even not can with the governments or even the international organizations. So we have to find a way to work together, starting from Africa and from the other continents. But we have to think internationally and act locally, but we need the same solutions. Thank you so much.
Thank you. We have the video sharing of the. Yeah? Okay. Okay. Which one? Okay. That is nice. Maybe we will play the video at the end. I think that is the only video we have. I will invite a very good friend of mine, my namesake. We worked with him a number of journey, and he has seen me grow. Allow me to welcome George Murimi from Colombo Plan to give a few remarks. When you do your trainings and everything on drug prevention, treatment, and the rest, this is the man to watch. And the good thing is that he's also from Kenya like me, and I don't want to say much. So after him, then if the video will be ready, well and good. If him to be ready, we will invite NCCS, and then we continue with the protocol. Thank you.
Thank you very much, George, my namesake. And then in the interest of time, I got a number of things that I was going to say. I think I'll put them in my presentation. I have a presentation in the afternoon and tomorrow morning. Again, we can even combine those presentations and do my presentation tomorrow morning. So I just want to say that in the spirit of African hospitality, we highly invite, or we highly welcome all of you who are from America, all those who from you, from Asia Pacific region, all those who from you, from the European countries. We highly welcome you to Africa. Welcome. Those of you from other parts of Africa, we also highly welcome you. We have realized there are delegates from other different parts of the continent where we operate, and I think we'll be speaking about that later on. I also want to extend a word of appreciation, a word of congratulations to the team, the coordinating team, which had all the different organizations which have been listed here. And I want to say for truth, this is the first summit of its kind. It is the first summit of its kind. The closest we came was when we had what we're calling Africa and Middle East Congress of Addiction, which we call MICA. That is the closest we came with. But to bring the Asian countries and African countries, particularly to deal with prevention, is the first of its kind. So, ladies and gentlemen, as you sit there, you just need to know that this is a historic moment. It may not look, but it is a historic moment. And from the program I've seen, it's extremely rich, particularly on issues of prevention, on issues of treatment, and issues of recovery. My challenge to the committee as I see it is that make sure that we are very definite what are the outcomes of this meeting. Secondly, we want to be very, very sure what are the resolutions. And then, most importantly, what are the recommendations you're making for the government and for the civil societies. Finally, ladies and gentlemen, I wish to remind you, Asia or the Asians constitute about 59% of the world population. Africans constitute about 19% of the world population. If you combine the two, we have 78% of the world. We are the world. We are the world. So if we get it right, the world gets it right. Unfortunately, if we get it wrong, we get it. Everything also goes wrong. So, ladies and gentlemen, I wish to say God bless Asia, God bless Africa, God bless the whole world.
Thank you so much, my namesake. As I said, we lead by being an example. My daughter is over there. I think she needs to come so that yes, I have to be a proud father, right? Come. She just came from school the other day, so we've not even met, interacted that much. Because I was in Istanbul, I came in and I came in yesterday late in the house. And do you want to say something? No, just say hi. Okay. No, you don't want to introduce yourself, even just saying your name.
Hi, everybody. I'm called Natasha. Hi again. I'm called Natasha Auma, the daughter to George. George Odalo. Yes, I'm schooling. I'm in high school, a school in Siaya. Yeah.
When we are in the house, she's very vocal. I don't know. Maybe she's afraid of the delegates here. Now, because I want to hand this to the government, and when I hand it over to the government, I will have to sit down. So don't expect to see me back. But before I do that, is the video ready? No. So we'll see how to sort it out. But allow me to recognize the following institution or countries or whatever, the way you'll call it. If I mention your country, you give them a very big clap, right? Kenya yenyu tutapanga baadaye kwanza. So let us give a very good applause to the United States of America. Then we have Jordan. We have Uganda. Oh, I can see another and another one over here. And then, yeah, to Australia. To Zambia over there. To Tanzania. I can see Tanzania. Brazil, Italy. Which other country? Norway. Yes. Which other country? Turkey. Where is Turkey? Then there is Singapore. Which country? India. Nigeria. Which other country? Somali. Which other one? Malawi. Germany. No, Netherlands, right? Yes. I'm saying them. Singapore, right? Sri Lanka. Sri Lanka. Which other country have I forgotten? Zambia. Yes. South Africa. Kenya. Okay. I think I thought maybe I was still in Turkey. I didn't want to recognize Kenya, but I'm back in my homeland. So, to Kenya, I know some of the delegates were not able to come in due to there was someone who had a burial along the way. Something happened, government changed things, but it is what it is. We have to continue. Allows me also to recognize the Nakada of Tanzania. I don't know the name, but here in Kenya we call them Nakada. So the Nakada of Tanzania, where are they? Yes, stand up, government representatives. So we are not only civil society. Thank you so much. And we had the Nakada of Uganda. Are they here? They confirmed. NDA. Are they here? Because someone reached out to me and they told me they were coming. Maybe they're on the way. Yeah. And then we have our host, the Kenyan Nakada. So Nakada is the agency that deals with drugs here. Gonna see you, just wave. I know you will speak. So if we see you with a bottle of something and some smoke coming, we will not even fight. We'll tell them to do their work. So without much ado, allow me to invite the representative of the CEO, National Council for Children's Services, to come over, who will introduce Nakada. Nakada will introduce the chief guest, and then we will proceed. We have apologies from other entities from government that are not yet here, but because it's live, I have to say so that they don't come on my neck, you did not recognize us. Is that okay? So once you're done, we will step out for tea, and then feel free to walk through the stands around here. Nakada is the first one. Government, pana mchezo. Welcome.
Thank you so much. Our guests, Honorable Maura, CEO, NACADA, Mr. Anthony, delegates from Africa and across Asia, good morning. It's indeed wonderful to note that the whole world is represented here. And for us, we really look forward to a solid declaration that will help us, address the menace around drug and substance abuse. Now, my name is Lucy Gatti. I work for the National Council for Children's Services, NCCS, and I'm here with my colleague, Director Nicholas. We are here to represent our CEO, Mr. Abdinur Mohammed, who was not able to join us, but he sends his warmest regards to all of you. Have we received? Thank you so much. Now, I very much want to echo the presenters on what they have spoken about prevention, being very, very critical in tackling the drug and substance abuse. I once had a privilege to visit a drug den in Mombasa some years back. And I can tell you it was pathetic because we had children being raised in such an environment. And science has taught us that the first 1,000 days of a child's upbringing, basically up to 8 years, are very, very critical for a child because that is the time when the brain and the neurons are fast developing. So whatever we subject that child to in those very foundational years, sorry about that, will go a long way in informing what type of a child that person becomes in future. So ensuring that prevention messages are saturated in all our homes, our communities, our environment is very, very critical to be able to really try and address the issue of drug and substance abuse. So allow me to kindly read remarks from my CEO. I'm not adding anything or subtracting anything. Distinguished delegates, esteemed policymakers, partners from Africa and Asia, representatives of international organizations, civil society, youth, advocates, and all participants, good morning. It's a great honor to join you today for the official opening of the Afri-Asia Drug Prevention Summit, an important platform for continental and intercontinental collaboration in addressing one of the most pressing challenges of our time, substance abuse, and its far-reaching impact on individuals, families, and societies. I wish to commend the Slum Child Foundation and its partners for convening this summit under the timely and profound theme, Drug Demand Reduction Without Borders. This theme captures the essence of our shared responsibility, reminding us that the drug menace is not confined by geography, gender, or age, and that our response must equally transcend institutional and national boundaries. Across Africa and Asia, the tide of substance use and addiction continues to rise, threatening the health, safety, and future of our communities, especially our children and young people. The proliferation of new psychoactive substances, coupled with the easy accessibility of alcohol and other harmful substances, has left many of our youth vulnerable to exploitation, school dropout, mental health challenges, and conflict with the law. As the National Council for Children's Services, we are particularly concerned about the intersection between drug abuse and child protection. Substance use among children is both a symptom and a driver of deeper social challenges like poverty, neglect, trauma, and social exclusion. Addressing drug demand, therefore, is not just a matter of public health, it's a matter of child rights and social justice. The Africa Charter the African Charter on the Rights and Welfare of the Child, and the United Nations Convention on the Rights of the Child, to which Kenya and most of your countries are signatories, obligate us to safeguard children from all forms of abuse and harmful practices, including exposure to drugs. It is within this framework that the Council, working with government agencies, county government, civil society, and development partners, continue to strengthen community-based child protection systems, promote psychosocial support, and enhance access to early intervention and rehabilitation services for children in need. However, we recognize that this fight cannot be won in isolation. It requires multi-sectoral collaboration across border cooperation and collective commitment. The Afri-Asia partnership offers a unique opportunity to leverage shared experiences, best practices, and data-driven innovations. For instance, the community-based prevention models emerging from parts of Asia can inform Africa interventions focused on youth empowerment and family resilience. Likewise, Africa's strong traditions and community solidarity and peer-led advocacy can inspire approaches that place social inclusion at the heart of prevention efforts. A truly borderless response to drug demand reduction must be comprehensive, inclusive, and sustainable. It must integrate, one, prevention and awareness, as has been stressed by the previous speakers, through life skills education in schools, mentorship programs, and community awareness campaigns that equip young people with knowledge, values, and resilience. It must integrate treatment and rehabilitation, expanding access to youth-friendly, gender-sensitive, and affordable rehabilitation and mental health services. Reintegration and empowerment, very critical, supporting recovery through vocational training, mentorship, and community acceptance to break cycles of dependency and stigma. And lastly, it must integrate policy and research collaboration, fostering cross-country research, data sharing, and joint policy frameworks that respond to emerging trends, especially in synthetic drugs. At NCCS, we are committed to integrating drug prevention into the broader child protection ecosystem, from parenting programs and social safety nets to education reforms and digital safety initiatives. We believe that early intervention is the most effective form of prevention. Every child diverted from the path of substance abuse is a life restored, a potential unlocked, and a family strengthened. As we gather here today, I urge us to reaffirm three core principles: solidarity, shared responsibility, and human dignity. Solidarity reminds us that no nation can fight this battle alone. Shared responsibility calls upon all sectors like health, education, justice, and social protection to work hand in hand. And human dignity demands that we treat those affected by substance use not with punishment or stigma, but with compassion and hope. Let this summit serve as a platform for fostering stronger continental alliances, creating innovative prevention strategies, and amplifying youth voices. Let it also challenge us to invest in prevention as a cornerstone of public safety, economic development, and national well-being. To our youth present here today, you are not just beneficiaries of these efforts. You are leaders and change makers. Your creativity, energy, and advocacy can transform communities and reshape narratives around drug use. We count on you to be the torchbearers of a drug-free generation. In closing, let us never lose sight of our moral compass, guided by the timeless words of Nelson Mandela. History will judge us by the difference we make in the everyday lives of our children. Let us remember that every life saved from the grip of addiction is a victory for humanity. Together, Africa and Asia can stand as a united front, sharing knowledge, compassion, and determination to achieve drug demand reduction without borders. May this summit inspire enduring partnerships, concrete actions, and renewed hope for our children and the future generations. I thank you all. May I now invite the CEO NACADA, Mr. Anthony, to come and speak to us. Thank you.
Thank you. Thank you very much. Our guest of honor, the government spokesperson, Dr. Honorable Isaac Maura, our great partners in the room, prevention champions, esteemed delegates, ladies and gentlemen, good afternoon. Hamjambo. Asante. My name is Anthony Americo. I lead the management team in NACADA, and I'm here, first of all, to give the apology of my chairman, who had all the intent to be here, but because of other exigencies of duties, he was unable to be here. Before I begin, allow me also to apologize for my croaky voice. I'm a little bit under the weather, but I assure you my enthusiasm for this Asia-Africa collabo is at its all-time high. I'm truly delighted and deeply honored to join you at this first ever Afri-Asia Summit on drug prevention. This is a momentous event in the history of prevention, more so on this side of the globe. The heartfelt appreciation will surely go to the Slum Child Foundation and partners who played a very critical role in ensuring that this day is a success. Ladies and gentlemen, this is a very important gathering, and it's a critical milestone that starts us off to a journey of great heights. I'm sure if we had more summits like this, I'd think twice about having a call like I have today. It is genuinely encouraging to see partners across continents working hand in hand to confront the global challenge of alcohol and drug abuse. At NACADA, we take immense pride in collaborating with like-minded organizations from both the public and the private sector in order to advance our shared mission of building a healthier and safer community. Ladies and gentlemen, substance abuse remains a major concern globally, and this region is not left behind. According to the World Drug Report of 2024, more than 292 million people aged between 15 and 64 are using drugs, which represents about 20% increase in just 10 years. That is not a statistic, it is a wake-up call. It is a call to action. And this summit epitomizes that call. Closer home, our last survey painted a worrying picture on the trends of alcohol and drug consumption in the country. The most shocking bit is that children as young as 6 years are being introduced to drugs. 6 years. At that age, these young ones should be worrying about homework, not hangover. And this is a call to action on the same. This is a serious threat to the future and present of this country and must be nipped at the bud. We are also witnessing a worrying trend and the surge of synthetic drugs within the region. This includes other controlled substances. Just over the weekend, a multi-agency operation led by the Kenya Navy and supported by regional entities intercepted a vessel off our coast, and therein they had over a ton of what is suspected to be methamphetamine of a very high level purity. Perhaps it is the fumes from this consignment that did me in terms of cold I think I have. Nakada was part of the operation. But jokes aside, incident is a very stark reminder of the magnitude of the threat that faces us. This is not just a story in the daily today and tomorrow. Its impact is alarming. The scourge that it has caused to our people is alarming. And this is evidenced by the people who end up in our rehabilitation centers. Ladies and gentlemen, while this summit focuses on prevention, we recognize that drug control is a holistic continuum. You can't talk about prevention without talking about suppression. They are intertwined, and we need to do an end-to-end intervention for all the challenges. As the national focal point for drug control in Kenya, NACADA has developed a range of guidelines and frameworks to support prevention and management of alcohol and drug abuse in schools, in the workplace, and within communities. We stand by the timelines, the timeless wisdom, and the mantra that prevention is better than cure. But truly, it is far more effective to do prevention, both in terms of costs and the impact thereafter. So prevention, prevention, prevention. And to achieve meaningful change, I call upon partners to intensify the efforts that they are already putting in prevention programs. This requires not only financial resources, but also a strong human resource base in the form of capacity. Capacity to execute thoughts and the projections that we have in mind. NACADA, we are committed to building this capacity, and we continue to roll out the UPC and the UTC trainings, and we have established systems for accrediting addiction counselors. I encourage as many partners as possible to take up these training opportunities so that our prevention and treatment services remain world-class, evidence-based, and sustainable. I'm currently a UTC student, and I've just realized the homework deadline passed. I don't know what the lecturer will say. Anyway, ladies and gentlemen, let me conclude before my voice stages protest. And as we begin this important summit, let us remember prevention is not an event. It is a total commitment. It requires all of us to raise awareness, strengthen partnerships, and recognize the unsung champions on prevention who keep our communities safe every day. They are our unsung heroes. We each have a responsibility to stand up and safeguard our communities, to protect our young people, and to secure the future of all of us and give us hope. Thank you for your attention and for your presence and for your passion in this very noble cause that is designed to protect our people. And now, before my voice becomes hoarse, let me say, God bless you and God bless your work. Finally, and importantly, it is my humble duty to invite our chief guests, the government spokesperson, Honorable Dr. Isaac Mwaura. A round of applause.
Good afternoon. Let's stand up for a moment. It's a bit make sure you say hi to one or two people. Yeah. Hi. How are you? Thank you very much. Okay, we can be seated. Distinguished delegates, esteemed experts, government representatives, development partners, civil society leaders, members of the state, good afternoon once again. I'm standing before you here as the most unlikely person to address this meeting, this great summit, but I counted about 20 countries that are represented here. And I am very delighted. I say unlikely because I'm not necessarily an expert on issues to do with drug and substance abuse, but as a government spokesperson, the official government spokesperson, then one of the things that I do, and Kevin was telling me, is that you should be able to know almost every other topic and speak like an expert without flinching. Thank goodness that there are written speeches. And then, of course, camouflage may be the depth of knowledge. And of course, if you are to use an AI to generate a speech, there's a way in which it doesn't sound human. We are here. Welcome to Kenya. It's a beautiful country. And I'm very happy that you decided to come to this place. In this All-Saints Cathedral, as George has said, it's very historical. And so in this hall here that we are celebrating this unity, I was asking my brother who is sitting behind me, if we talk about 78% of the world constituted by Africa and Asia, then that's quite fundamental. That's quite fundamental. And I think maybe it started in the West, if at all we can say so. That's debatable though. But now you can see the future of the world is looking like it's in Asia, but it will eventually come to Africa. I've just come from being in Papua New Guinea. I had somebody from Australia, and also in Philippines, Manila, in Hong Kong, in also Bangkok. So you can see, you can tell actually the differences. But yeah, you came at a very good time because as my brother has put across, capturing a vessel that is stateless, with a ton, 1,024 kilograms of methamphetamine, 98% pure, with 6 Iranians, who are being interrogated. I think that exactly underscores the theme of our summit, that drug demand reduction without borders. It's borderless. So transnational organized crime is critical. It is affecting this sector. It's affecting issues to do with money laundering and illicit financial flows. And it has actually been able to be connected even in overturning the will of the people in democratic countries. Some governments have actually been propped up using some of this illegal, this borderlessness, and so therefore it's extremely important for us to think of ways in which then we reduce the demand for these drugs, that people are actually going to see them as part and parcel of their society. I was actually debating whether, of course, we need to move the conversation to also being addicted online. And I was wondering whether it should also fit here some kind of a drug, because I think now this addiction has been codified through clicks and baits and all of that. But maybe that's a forte for other agencies and other summits. But it is important maybe to also underscore and study the correlation, the covariance, the intersectionality of these two, because I think one is a derivative of the other. It is an honor and privilege to address you this distinguished august gathering at the opening of the Afri-Asia Summit on Drug Demand Reduction Without Borders. forum that symbolizes our shared commitment to a healthier, safer, and more resilient world. This summit brings together nations from 2 continents, actually more than 2 continents, that have faced the complex challenges of substance abuse and its devastating impact on families, communities, and economies. Yet it also brings together our collective resolve to work collaboratively, grounded in science, human rights, and solidarity, to prevent and reduce the demand for drugs across borders. Distinguished delegates, Afri-Asia Summit resonates deeply with the Sustainable Development Goals, SDGs, particularly SDG 3, to ensure healthy lives and promote well-being of all at all ages. More specifically, Target 3.5, which calls upon nations to strengthen the prevention and treatment of substance abuse, including narcotic drug use and harmful use of alcohol. In accordance with the Constitution of Kenya 2010, particularly Articles 10 on national values and principles, Article 21, Article 27, 43, and 55, the state has an obligation to promote and protect the right to health, ensure social justice, and safeguard youth and vulnerable populations from harmful practices, including substance abuse. Drug demand reduction is therefore a constitutional duty integral to realizing the highest attainable standard of health, human dignity, and sustainable development for all Kenyans. Drug demand reduction is also an isolated issue. It is integral to achieving universal health coverage, which is one of the 5 pillars of the Better Plan, which is our manifesto and also within our medium-term plan 4 of the Kenya Vision 2030 to raise this country from a least developed country to a lower middle income economy. Social justice and inclusive development are also critical in ensuring that we get to that end. When people suffering from substance use disorders receive timely, affordable, and stigma-free care, we take a decisive step towards leaving no one behind. Ladies and gentlemen, fellow citizens of the world, the government of Kenya remains steadfast in its commitment to a drug-free, productive, and healthy society, guided by the National Policy for Prevention, Control, and Mitigation of Alcohol and Drug Abuse, the NACADA Strategic Plan, and the Kenya Mental Health Policy. We are strengthening systems for prevention, early intervention, treatment, and recovery. Our government's approach is anchored in 4 pillars. Number 1, evidence-based prevention, ensuring that policies and programs are informed by reliable data and proven methodologies. Number 2, integrated treatment and rehabilitation, aligning with the principles of universal health coverage to make services accessible to all, irrespective of geography or economic status. Number 3, community empowerment and participation, recognizing that sustainable change begins at the grassroots. Here we say at the bottom of the pyramid. And number 4, cross-sectional partnerships, because no single entity can address the challenge alone. You know, when I was in the civil society, we used to have a situation where you talk about your organization and you say Kenya National Drug Association. It covers the whole world, yet you have a single office there in Nairobi here. So no single entity can work alone. In fact, in Kiswahili, we say in Kenya, Uganda, Tanzania, kidole kimoja hakiui chao. We are investing in capacity building, empowering practitioners, counselors, law enforcement educators, and community leaders with knowledge and tools to respond effectively. Distinguished delegates, the government of Kenya emphasizes the role of research and professional practice. Research remains the cornerstone of innovation in drug demand reduction, data-driven decision-making that allows us to identify trends, assess vulnerabilities, and evaluate what works. We must continue to strengthen collaboration between research institutions, professional bodies, and policymakers, ensuring that interventions are both context-specific and globally informed. Professionals in health, psychology, social work, and public policy play a vital role in translating research into practice, designing prevention strategies, recovery programs, and social reintegration initiatives that uphold human dignity and equity towards the enjoyment of human rights and fundamental freedoms for all. In the spirit of inclusivity, Kenya's intervention focused on targeting vulnerable populations. As we pursue these goals, we must not forget the most vulnerable amongst us, that is the youth, as represented by that beautiful girl who was here, women, refugees, and persons with disabilities. They often face multiple layers of vulnerability, including stigma, exclusion, and limited access to services. Our policies and programs must therefore be inclusive, disability responsive, gender sensitive, and youth empowering. By addressing the social determinants of health, poverty, unemployment, trauma, and lack of education, we reduce not just the demands for drugs, but also despair that fuels it. Finally, ladies and gentlemen, community ownership and sustainable financing is key. Effective prevention and treatment depend on community ownership. Families, faith-based organizations, and community-based organizations are the first line of defense against substance use. We must therefore invest in community structures, local leadership, and mentorship networks that reinforce protective factors and resilience. At the same time, we must advocate for sustainable financing of prevention and treatment. Short-term projects cannot win a long-term war. Integrating drugs demand into national budget for health, insurance schemes, and public-private partnership will ensure continuity, scalability, and impact. Africa-Asia Summit delegates, I call upon all of us to have a shared responsibilities. The challenge before us transcends geography, politics, and culture. The fight against drug abuse is not a competition between continents, but a collaboration across humanity. Let this summit mark a new chapter, one where Asia and Africa and Asia stand together in solidarity, guided by evidence, compassion, and the shared vision for a generation free from the harms of substance abuse. The government of Kenya reaffirms its commitment to working with all partners represented here in research, policy, prevention, and care to turn these commitments into concrete, measurable action. Together, let us build a future without borders, without stigma, and without despair. A future defined by hope, health, and human dignity. Thank you, and God bless. Now, it is a custom. I think we put the cart before the horse, but it's okay. It is now time to say the obvious. But before I do so, let me share two quotes. If you follow my socials, you'll see I write something called Isaac Maura Speaks. These are my small nuggets of wisdom reflecting on my journey as a leader. For those of us who are in Kenya, you know, I've been an advisor to the Prime Minister, may his soul rest in peace, Raila Amolo Odinga. I've been a member of the National Assembly. I've been a senator and now government spokes. So one of the things that I've come to reflect upon the life of Right Honorable Raila Odinga, because I have worked with him for about 10 years, is as follows. That the legacy of a true leader is accumulated over a lifetime and cannot be tied to a position that is only but transient. Let me repeat. The legacy of a true leader is accumulated over a lifetime and cannot be tied to a position that is only but transient. Number two, which is the last one, the tenure of a true leader is limitless. Thank you. With those many and few remarks, I now wish to declare this conference, summit, officially open. Makofi.
Okay. I have an announcement to make, but I don't want you to go.
Okay.
You know, the government, when it sits down, it's very difficult to tell them to rise up again. So I have 2 or 3 announcements to make. One, we will break for tea and we will also break for lunch. So we'll combine two together. Make sure you are fed well because according to us, where I'm coming from, food is the number one priority. So we'll break for tea and then we'll take lunch. I will expect each and every one of you to be in either this room or the other room at 1:30. So you have enough time to socialize, network, and do the necessary. Two, okay, so I will invite Nkatha to take charge and then we'll see what next. Okay.
Thank you very much. Let's give them a very big hand. Thank you, Honorable Dr. Isaac Mwaura, for the keynote address and all the distinguished guests. So we would want to award you for taking your time to share the morning with us and the insights. So I'll ask George to assist me to issue him with an award.
Okay. That's it. Let me hold it like this.
Okay.
Enjoy that photo. Yeah, all right.
Make sure I'm brown in that photo because next time when I'm looking for government job.
Dear Honorable, we will request also a group photo after we can be able to have Dr. Omerikwa also join us on stage to receive an award, which will be given to him by Ishmael of Blue Cross Kenya. Let's give him a hand. Thank you so much, Dr. Omerikwa. He's the CEO and he has been working relentlessly. Let's give them a big hand. We also want to appreciate Lucy Gatti, who has also shared what they're doing to protect the child. And she has been able to offer the speech this morning. Let's give her a hand. Thank you so much. This certificate will be issued by Catherine Mudiani from SAPTA College, which is a partner of this summit. Let us give her a hand. We also want to appreciate Gilbert Biwott from the same organization because they sent a team. We really do appreciate the CU as well. Let's have him have a certificate issued by Dr. Pamela of the Institute of Substance Use Prevention Professionals. Let's give him a hand. We want to appreciate a keynote presentation that was offered by a man so passionate about drug prevention. And he mentioned he has worked with the White Houses for 3 terms. What a privilege to have him in our midst. So, Dr. Kevin Sabet, kindly come and get a certificate that will be handed to you by Benjamin of SCAD Kenya. Let's give him a hand. I hope we have strategies. All these people who we are mentioning, I hope we will not let them leave without exchanging contacts and making sure you can maximize on the networks that are in this room today. Let's give him a big hand again, Dr. Kevin Sabet. We also want to appreciate Colombo Plan. They are the ones who have been able to equip us with knowledge and skills. And George Murimi was able to take us through that session this morning. And we look forward to the breakout and the plenary later on to hear what he has to say. So, George, please come on stage. You will be awarded your certificate by Dr. Susan Gitau from Elewa Ulevi. That is Swahili to mean understand addiction. Not learn how to get. Thank you so much, Mr. George. Wow. And I'm truly honored to also call this distinguished guest to the stage, this morning, this afternoon, to receive an award. Dr. Rogers, an amazing leader, our neighbor from Uganda. You are an enigma in the field. There are many people who are registering and they were saying, we have to come and listen to our leader. They're coming from Zambia. They're saying you taught them. So really, we do appreciate that you made time to come. And I know we will be engaging during this 3-day event. To give him his award, I would like to call upon Sonali from our foundation. Let's give her a hand. And finally, kindly let's give them a big hand. And now I will request a group photo kindly. If we can have Honorable Dr. Sir Isaac Maura join us on stage with our, can we do a group photo from the outside, please? So that we can have all the delegates, all the speakers in that picture. And note, okay, we make decisions on our toes. Let us do the picture for the distinguished guests on the stage with this background. So kindly, Honorable Dr. Isaac Maura, Dr. Orlando, Sabet, all the speakers for this morning. We also have a distinguished guest from Nigeria. He's the advisor to the governor of Kwara State. Please join us on the stage. We have Mr. Musa from Jordan. We have Dr. Titus from India. Please do come to stage and we can have a group photo. And what do we say? You know, they say cheese, but here we will say, what do we say? Drug prevention without borders? It's too long? Oh, Niko Soba. Okay.
Oh, Afri-Asia Nikosoba. Okay.
Ishmael? We have also representation all the way from Norway. Please join us on stage kindly.
Okay.
Thank you very much. Then we can proceed outside for a group photo. All delegates will receive a certificate of participation as well at the end of the summit.